Doing the intraosseous infusion using the EZ-IO. We've considered our scene safety and we are using our standard precautions of gloves and glasses. I'm going to start by introducing myself to the patient. Hello, my name's Tom. What's your name?
Ingrid.
Hello, Ingrid. Nice to meet you. We're going to talk to the patient about the procedure and we're going to gain consent from the patient and from the carer or a parent. So today, we're going to stick a needle in your arm to give you some medication to make you feel better. Is that okay?
Yes.
Yeah. And we're going to explain to the parent what this involves for the EZ-IO, using the drill to push a needle into the bone for easy administration of medications. We're going to get our equipment ready. In this case, the EZ-IO driver, the needle set, which in this instance is the blue 25mm needle indicated for patients greater than 3 kilos, our skin prep wipes, our dressing, and our syringe flush and IV tubing. We're now going to position the patient accordingly for the proximal humerus insertion site. So Ingrid, if I can get you sit comfortably there, place your arm in your lap, and I'm just going to have a feel around your shoulder here. Is that okay?
Yeah.
All right, so I'm going to place one hand over her shoulder and using the palm of my hand, feel the ball of Ingrid's shoulder. I'm then going to use the ulnar aspect of one hand on the midline of Ingrid's humerus and the ulnar aspect of my other hand on the axilla. And I'm going to use my thumbs to feel the surgical neck of Ingrid's humerus. It's this site, approximately 1 finger width above, where I'll be inserting the EZ-IO needle. The site's not contraindicated, as there's no signs of fracture to the bone. There's no indication of previous attempts which have penetrated the cortex of the bone, and there's no overt indication of overlying infection to the insertion site. We will now use our skin prep to prepare the site, and then ensuring no touch techniques once the site has been sterilised. We can then move on to inserting the needle in the arm. So I'm going to warn the patient, Ingrid, you're going to feel a small sharp scratch where I'm going to stick the needle in your arm, okay? And then some noises from my little drill here, all right? We're assuming that the patient is, if they're tolerant to pain or intolerant to pain, the appropriate medications are administered prior to, or anaesthesia is applied prior to insertion. So at a 45-degree angle, perpendicular to the skin, I'm going to insert the needle till I feel the bone, and then using the drill, I will drill until I feel a small pop or give as the needle inserts into the bone. I'll then remove the drill, leaving the EZ-IO in place in the patient's arm, and I can remove the stylet and place it in a sharps container. From there, I will look to flush the EZ-IO to ensure patency, and once confirmed, I can place the dressing over the EZ-IO to secure it in place. From there, I can apply IV tubing as required and administer the medication as required.